Okay, it looks like we had a little hiccup with our connection here, and hopefully everybody can get back in. Give people just a moment to try and get in. Okay, so I'm going to go ahead and keep going with the joint supplements. Not quite sure where it cut out, but I will back up and talk about joint supplements from the beginning. So joint supplements are very useful anytime we've had joint symptoms where you've had stiffnesses, sorenesses, or known joint problems as part of your Lyme cases, or horses that have been through bad Lyme, and now they're 2 or 3 years down the line. They should still be on some types of joint supplements. So one of the things that I think is quite useful is to change classes of joint supplements each year or two so that you're not using the same type of information going into the joint the same way all the time. The joint is a complicated structure, and I think in general, unless you have a horse that definitely does best on a particular product, that you rotate periodically. So hyaluronic acid is one class or one type. The glucosamine types of products, glucosamine chondroitins, one of my favorite ones there is actistatin. The glycosaminoglycans, which is more of your Equine type of product. We have the green lip mussel, which is where all of the joint products started many years ago. And I found a product now that I'm really happy with called Pernologics. And then we have herbal, we have Western-based herbal formulas, Hilton Herbs joint products. We have Chinese-based joint products. And then we have Legend and Equine as injectable joint products. And we will at some point do a webinar just on joint supplements because there's really a lot of information out there about them and people commonly use them. Other supportive types of treatment for Lyme and for the symptoms of Lyme are magnesium. And magnesium is an interesting compound. We use a lot of magnesium for different things. We use magnesium to calm horses down. We use magnesium a lot for our insulin-resistant horses, but there's also a lot of evidence that magnesium helps with the myofascial pain and the muscle pain that goes along with Lyme. So we can feed magnesium internally. We can also use some topical magnesium products, and we're going to get some topical magnesiums on the website in the near future. The topical magnesium can be quite useful because magnesium itself can be a little bit upsetting to the digestive tract of some horses. Think about using the salves and sprays if your horse is showing a little bit of loose stool. Magnesium, especially the form that's used by many people, is like magnesium sulfate, which is like eating Epsom salts. Then another product that can be very, very useful is curcumin or turmeric. And turmeric is a great anti-inflammatory. It's fabulous for supporting the immune system. It's anti-inflammatory in almost every body system, from the brain to the gut to the lungs to the liver to the heart. So it's one of those kind of all-around big bang for your buck kind of supplements. And I will use that for a lot of my horses. If you're in a part of the world or the country that has hyperbaric oxygen therapy available, or you have ozone therapy available through your holistic veterinarian, then you can take advantage of hyperbaric oxygen therapy or ozone therapy if you have it available in your area. I think it can be beneficial. We can also supplement with garlic to keep the buggers away. We can use, and often need to use, a lot of gut herbs. Garlic is a really good sort of bug repellent, and it supports the immune system a little bit. But our gut herbs can really help heal the immune system in the gut, as well as the gut itself, after they've been through a lot with antibiotics. And some horses after or even during their antibiotic treatment their intestinal tract is fragile. And I use a lot of the Hilton Herbs Digest support for that. We need to exercise the horses at whatever level the horse is comfortable. It is important for them to get exercise. It's important for them to move their chi and their energy and improve their circulation, but the really important thing is not to overdo it, because if you have had Lyme yourself, or you know anybody who's had Lyme, there are days you just plain don't feel like doing anything. So if you go out and your horse is having one of those kind of days, don't do anything. Just take an easy day, take them for a walk, either sitting on their back or just taking them on a lead line and going out and eating some grass and enjoying some time together. Lyme is a serious illness, and there are days that you just don't feel like doing much. Stress is the big thing to be avoided. Stress often causes relapses, and you have to figure out what causes the relapses for your particular horse, or what causes stress for your particular horse. Some horses thrive on competition, though traveling certainly can be stressful, and being away from home for multiple days can certainly be stressful. Some horses do it very, very well. Some horses get stressed by it. The same thing when it comes to moving from one barn to another, changing pasture mates. I have some horses that are totally stressed out if you just move their pasture mates around. Confining them too much. Horses don't really like to be confined, kept in stalls all the time. They need their exercise. They need their time with friends. So you have to figure out what is the stress to this individual horse's system. Riding, doing a clinic where you're really working them or overworking them. You're trying out some training techniques that maybe aren't working too well. Vaccinating them a lot. There's many possible reasons why they could become stressed. Stress increases the level of cortisol, natural body cortisone. Cortisone suppresses the immune system. So the goal is to try to not totally avoid stress, but pay attention to it and figure out how you can make it less stressful. And you can also use some of the adaptogenic herbs and even the Bach flower rescue remedy. And the APF Plus is the one that I use a lot because it's a nicely balanced adaptogenic herb. The Eleutherococcus or Siberian ginseng can even be used by itself. The other thing is that in some cases you actually need to rethink a horse's career. If they get stressed every time they go to a horse show and they have a little relapse, then maybe it's time for them to become a trail horse, or maybe it's time for them to do something different. Most horses can go back to their previous career once they have recovered, as long as you support them. But there are definitely times in which they have to rethink their career. And if you talk to people who have been through Lyme, there are people who have had to rethink their entire how they're going to approach their life. So it's not just the horses. Prevention, it would be great if we could completely prevent it, but I think we'd have to send our horses up to the moon at this point, and the ticks would probably follow. So we need to support the immune system. We need to reduce our vaccines to only the ones that we need. We can check titers, and you can have your veterinarian actually check the titers for the different vaccines. And I have a whole article on the website about vaccination and how to kind of rethink vaccines and what we really need. We need to watch our stress, and we need to also support the gut bacteria. So let's say your horse goes out and gets a cut on his leg, and so the sort of normal reaction is to go ahead and give him some antibiotics, but remember, the antibiotics suppress some of the immune system. So suddenly what seems like a simple little cut turns into a trigger for a relapse. So make sure that if you use some antibiotics or some kind of drugs that could affect the gut, even non-steroidal anti-inflammatories such as butanbanamine and all of the others that are out there that can affect the gut, go ahead and support your horse at the same time with probiotics, with herbs to support the gut, as well as something like APF for the stress itself. So we've made it to the end. Lyme can be managed. I'm not going to sit here and say we can cure it all, but it can be very well managed. Horses can go on and have productive careers. We have to learn as much as we can about Lyme disease and keep moving forward. This webinar will be edited. It looked like we had a little bit of an interruption in the middle of it, and we will make the entire link available to everybody sometime within the next few days. So if we still actually have people on board, let's take some questions. And you can type it into the question box, and hopefully I will be able to see that. So any questions? Okay, if there are no questions at this point, we will go ahead and sign out and send you all a link with the whole broadcast. Thank you all for attending, and we'll see you next time. Take care.